Let's take time to hear from seniors and dementia advocates about living. Welcome to What's Next Canada, Canada's premier aging and brain health conference, repurposed for you in a special podcast series. Listen in to this panel discussion entitled Lived Experience, Innovating with Seniors for Seniors. The moderator is Dr. Allison Sekuler, Managing Director of CABHI. The panelists are Sue Drohan, a member of the CABHI Senior Advisory Panel, Sam Herskovits, a member of the CABHI Senior Advisory Panel, Ron Posno, a dementia advocate, and Len Carter, a dementia advocate. Here we go. Now streaming, listen in to this panel discussing the lived experience, innovating with seniors for seniors.
It's a pleasure to have y'all here virtually, and thank you so much, Jean, for that exciting keynote to open us up. And I'm also we're watching the number of participants at the bottom of the screen, and it's just amazing that we already have over 100 different people from around across Canada, across North America, around the world, joining us at this early hour virtually. And we're going to move into our first virtual panel, which is our Lived Experiences panel, Innovating with Seniors for Seniors. And I'd like to just briefly tell you who the folks are on this panel, and then I'll let them do a quick introduction of themselves. We've got first, I'll just go in the order that they're shown there, which is Sue Drohan, who is a member of CABHI Seniors Advisory Panel. Sue, welcome.
Thank you.
We've got Sam Herskovits, member also of CABHI Seniors Advisory Panel. Sam, welcome.
Thank you.
And people, in case people are wondering about the pictures behind Sam, he has, how many grandchildren did you say you have, Sam?
19 right now.
19. So he has, this is just one of many, many walls of pictures he's got in his house of all of his grandkids. Ron Posno, who's a dementia advocate. Welcome, Ron.
I'm pleased to be here.
And Len Carter, also a dementia advocate. Welcome, Len.
Good afternoon. My name is Len Carter, and I am I'm a member of Dementia Advocacy Canada, and hopefully you would have received cards like these with your registration. They're display cards, and there's a lot of good information on them. You're going to get, you would have received a whole bunch more with Jean's presentation, but if you took these and you put them up, just put them up in your office, all of the persons that are affected would probably be able to get to it too.
That'd be great. We can also send out a link to Dementia Advocacy Canada to all of the participants so that people can get more information about the work that you guys do. So I'd like to just start by asking you each to introduce yourselves a little bit more, say a bit more about your background, what led you to be on today's panel, just in a minute or two, and then we'll start in on some other questions about what we can do to help folks innovate with seniors and for seniors. So Sue, do you want to tell us a little bit about yourself?
Sure. So as Allison said, I'm a member of the Seniors Advisory Panel at CABHI. I have two parents with dementia, so I have the caregiver experience behind me. And I'm a scientist by education, so I bring that lens to the Senior Advisory Panel. I hope we'll have a chance to talk a little bit more about what the Senior Advisory Panel is in a few minutes.
Hi, my name is Sam Herskovits. I'm also a member of CABHI Senior Advisory Panel. I retired about a year ago. I was a senior lab technologist in clinical chemistry immunology. And my mother had Alzheimer's and dementia, and I was a caregiver for her for many, many years at the Baycrest Apotex. And I went through a lot with her, and I have a lot of experience of what goes on in the healthcare system. So I wanted to join this committee and to just get more information about what's going on everywhere concerning people and elderly people and how they're coping with their lives.
Want me to go ahead? Okay. Obviously, yeah. I started. We were talking in the breakout room earlier, Allison, just a little bit, but I got started military college graduate, then into school teaching. Very early in my career, I got involved with special needs children, and that moved from children to adults. I spent a large part of my life being concerned with that. I won a national award for the innovations I was doing in dealing with special needs. Now, I mention that because the irony of it is, here it is, years later, and now my focus on special needs is really related to myself, the people I'm associated with with dementia. So my focus right now is what I did with education. You teach people, you show people, you work with people, focus on what they can do, and not worry about what they can't do. One of the blessings of dementia is that I can forget very quickly what I can't do, but I do try to do something every day with the abilities that I do have. And unfortunately, I can get up in the morning. I got 4 hours. I wake up, sun's up, I get up, then I ask my wife, Sandy, what's up? And we go from there. Yeah.
That's a great attitude. Len, you want to introduce yourself a little bit more?
Yeah, I have a history in broadcasting. I worked in broadcasting for over 30 years. As you can tell, I'm tall, dark, and handsome. The actual reason for my dementia has been described to me as the multiple operations that I had. Starting about 8 years ago, I had a heart operation. Then I had several chest operations. I've had my hip broken and replaced 3 times. And recently I had a knee replacement. And from what I've been told, it's the interaction of the drugs that caused my dementia. Now, it hasn't stopped me much because I just keep doing. And that's what I want to express to everybody, that the need to continue to do is enormously important for people with dementia.
Right.
Yeah, that's another great message. I think that one of the reasons we wanted to have this panel is because we think it's really important for people to understand when they're innovating that there's a diversity of issues that people face. People come at these issues from, they end up where they are for lots and lots of different reasons, as you guys have just explained. And they come at it from all different kinds of backgrounds. And I think it's really important for people to hear directly from the folks, that we're here to serve at CABHI, people who are at risk for and living with Alzheimer's disease and related dementias, as well as their caregivers and their families, and people, and the worried well as well. To that end, one of the things we did recently was we actually took CABHI on the road, and we are continuing to do this because we wanted to hear directly from as many people as possible. And so we did a CABHI on the road tour, if you will. And we have a little video, I think, that highlights the kind of things that we were doing there, which is now going to be shown very quickly, just for folks to see. Maybe. We'll see.
What we're really trying to do is help people not just live longer, but live better. We want to add life to years, not just add years to life.
Quite often that the younger population does not understand it because they have not lived it yet. They have not been there.
We're all in the process of getting older. So how do we use things like exercise to help improve the way that I'm taking care of not just myself physically, but myself mentally?
What do innovators need to know about older adults and their caregivers?
I think one of the biggest challenges facing the aging population in one word: isolation.
Maintaining independence.
Access. It's very hard for an innovator to know about an older adult until they've been there.
Be clear and simple.
The importance of older adults in our society.
Thanks, CABHI.
Thank you, CABHI.
Thanks, CABHI. Great job.
Thank you, CABHI.
Thank you, CABHI.
Thanks, CABHI.
So that CABHI on the Road tour that we did was really inspired by the work that our Seniors Advisory panel at CABHI does for us. And Sue and Sam are two of our members of that Seniors Advisory panel. And really, you know, every time I describe to folks what the Seniors Advisory panel is, folks are just shocked. I was at a meeting yesterday, and we told them that you guys met every 2 weeks to sort of connect and provide information, and people were just amazed by that sort of dedication. You know, in understanding the extent to which we've got you know, amazing amounts of input, both for CABHI and also for our innovators from all of you. Well, let's reach out a little bit more even and see if we can understand more broadly from a more diverse range of folks what's on their minds. And so as you'll see in the graphic that's there, we had a graphic artist at each of these events who was mapping out graphically all of the different discussion points that were raised. And we have all of these on the website for people who want to take a look. But the real questions that we were asking, and this is what we want to bring to you guys here today, are what are the challenges that people face today as they're aging? What do people see as an ideal future? And what are the most innovative solutions that you think would help us get to that future? And what are the words of wisdom you can provide to innovators to help them achieve that sort of future? So I wonder if we can start a little bit with just some of the challenges and the ideal future. So challenges and ways that you think that those could be approached. What is it that innovators need to know about what's on your mind in terms of aging?
I'm an advocate for the elimination of stigma, the myths of stigma. If people didn't, I mean, we have this word called demented, which is not dementia, but which is related, and people are afraid of it. And if we get rid of the stigma of the myth of dementia being horrid, then people will be more open to it. I know people who have the issue, the concern, the condition, and they refuse to think about it or go for treatment or join any group that might be associated with it even. So.
The issue of stigma came up a lot, and the issue that you raised, that because of the stigma, people don't necessarily want to even know if there's an issue, which means that if there are ways of providing intervention early, they're not accessing the latest information. All right, Ron, when you were shown on the video because you were out at one of those sessions we went to, I believe it was the one in London. And you told a great story about, you know, what's possible living with dementia that I think addresses some of those issues around stigma. Do you want to share some of your thoughts?
I can't remember what I said in London. I do talk regularly. So, but I agree with Len entirely. I think our biggest issue here in Canada is this fear of dementia. You know, here we talk right now, we have almost 500,000 cases of dementia in Canada. That's what we know about. And that's what we know is that's more than breast cancer and prostate cancer combined. 500,000. Now, I will bet you there's more than half that number who have not been assessed.
Yeah.
So there's a great many more. And I put it in terms like this. Our Liberal Party last June announced a national dementia strategy. They talked in terms of, I think it was $70 million they want to put. Now they haven't done anything about it yet, but they talk in terms of $70 million. And I looked at that AARP, and they have 60 million bucks that they're putting in themselves into this respect. So I would like us as a suggestion, but we do have to get around this notion of the stigma that's associated with it. And people just don't know. And that's their fear of it. We got people who put it off eventually. By the time they get assessed, it's really too late because they've lost too much of their capability to do anything about it. Whereas I was assessed early. I have what they call minor cognitive impairment. That's a precursor to all of this stuff. So I've got 10 to 15 years. I won't even likely live that long, be able to use the time I've got in my period of dementia. But I'm going to profit from it. I'm going to challenge people. I'm going to work with people. And a task I have every day is to help somebody else.
That's a great attitude. And I think that's, what keeps people going is recognizing that dementia is not a death sentence by any means, right? And mild cognitive impairment certainly is not. And the more you know, the more you can do to maintain your health and your physical health and your cognitive health for as long as possible. Sam, do you want to chime in? What are the concerns that you see for people as they're aging?
One of the major concerns, I think, is like loneliness. People in institutions, you have family visitors. You need people to always be with, like, for instance, my mother. She was so happy every day that I went to visit her, and a family, my children would come visit her. So it was loneliness that was a big part of what was her problem that she had. But the dementia, caregivers helped a lot, especially Baycrest. They were fantastic. My mother loved music. Music was a big factor. Every time she was listening to music, they had concerts. She would love to go to the concerts. So, and getting off the floor was a big deal too. We went around all the time. When the weather is better, you go outside and see the flowers and see everybody. Just to see more people helps a lot for people. But with caregivers, it's hard for the caregivers as well. It's difficult, but it looks like the future is doing well. I'm hoping things get better with virtual reality. That would help a lot, people for that, and robotics and robots in the home will keep people in their home so they don't have to be institutionalized. A lot of research going on with that, a lot of things coming out with robots, robotics in the next 10, 15 years. So it looks good. Technology is going to help unbelievable for people with the dementia and Alzheimer's.
Yeah, even in the precursor to this open panel, when we had a little discussion in the room, folks were mentioning that the virtual linkages that we can have through telecommunications in this way, video chatting and so on, that's a great, it's not a total substitute for human contact, but at least it's a way of bringing people together that they might not. And, it's really exciting seeing some of the solutions coming through CABHI, including the LEQ, the robot that helps people maintain connections when they're living alone so that they can stay connected. And as you mentioned, virtual reality, we've got on the screenshot below an example of a virtual reality solution.
Right.
Even if you're in long-term care and you can't get to the beach, you can go there virtually at least. So that's a great solution. Sue, do you want to just chime in before we move on to the next part of the discussion about what you see as some of the challenges? You're muted right now, so you might want to unmute. You're still muted. I don't know if someone can help Sue unmute. Oh, there you go.
How's that? Is that better?
Yep.
Perfect. Okay, so one of the biggest challenges I found as a caregiver for two elderly parents was navigating the care system because my parents started out living at home and quite successfully for a long time. And then, but even then, certain care was needed. And then they progressed, to where they were in residential treatment, if that's the right word for it. But finding that and finding the right place and making it affordable it's very challenging. The system is fragmented, it seems, and for caregivers to get training on dealing with dementia patients. Luckily, well, luckily for my mom, I learned a lot when my dad had that experience, and so I'm much more able to communicate properly with my mom in a way that's effective. So I think the whole issue around finding reasonably priced care and navigating the system and training, for lack of a better word, loved ones how to deal with this condition.
Yeah, and there's some great resources that are coming available now, including iGeriCare, which is a free resource open to folks to learn more about who are potential caregivers or even individuals recently diagnosed, to learn more about what is dementia and how to best care for people with dementia and how people with dementia can care for themselves as well. So, you know, these are similar to the sorts of themes that we were hearing when we did our CABHI on the Road tour. Loneliness, isolation, stigma, care coordination, all of the issues around, being able to connect with others and maintain good cognitive health for as long as possible. And Sam's already alluded to some of the potential solutions that are out there. And I'm wondering, you know, in a perfect world, what would you guys see as the world looking like for those of us, you know, as we're approaching our older years? What would the world look like? I mean, Jean had mentioned that we're going to see people reaching 150 and so on in the coming years, and people who are 10 now are likely to, or possibly going to likely live to be at least 104. So what would a perfect world for aging look like for those folks and for you?
I think it's really important. One of the things that Sue said, I think it was Sue, regarding training. I think that we should go well beyond training into education. The people who give us care are not educated in our needs. They don't have a full background in what we need, and they may have had people like me to look after, but I don't think that's enough. I have a caregiver. She's a wonderful person. She's my wife, but and I don't say but in any kind of a diminutive way. She has no background, no training whatsoever in caregiving, and she also has no relief. There's no relief for a person who gives care. There's no break, if you will. These people are full-time, 100%. We're committed to our care, older people's care, and they have they're stuck, and I can see them getting frustrated. One of the other issues that's really important is socialization and living together, and not being institutionalized. Being able to live with other people and not be in an institution is kind of important. In another life, in another forum, I talked about, related, but I talked about housing and the need for housing and the need for the possession of small homes that are connected so that you have a place, it's yours, you get to look after it, you own it, and yet you're able to socialize with other people in similar situations. And I think that's an important imperative. So.
Yeah, really good point. Ron, you wanted to chime in?
Well, there's lots of things here to kicking on. Just the last point that Len was talking about. They've created, this is out on Vancouver Island, the dementia-friendly village. It's part of a whole seniors complex, because they got a section of it with the kinds of little homes that Len was talking about, and a community in which the people with dementia can walk, wander. I hate to use that word because people get offended by it, but that's a natural way for people to walk around. But they can do it safely and be contained. And they have all the resources, extra resources to back up their primary caregiver right there within their community. I think it's a wonderful idea, but we don't need to have everybody that way. I say everybody, too many people, that's not everybody. Too many people look at that end of life stage, that dreaded stage that we're all going to come to in dementia. But that's in the last few years of one's life. You've got, in my case, I've got maybe 8-10 years of, granted, my capabilities are diminishing, but I can participate. That means I can meet with my buddies down at Tim Hortons for coffee. I can go play golf. They can keep score for me, but they kid me anyway. So it's all part of natural normal living. We've got all kinds of senior activities in our community. They don't need to be just, quote, for seniors, excluding dementia people. They can build some dementia activities into those kinds of things so that dementia people can participate as part of a dementia-friendly community. So I could go on for hours as to what we can do right here at home.
Yeah, and that this issue of designing things for inclusivity is so important. It's universal accessibility would help everybody, right? If we can design things that would be inclusive for everyone, it's going to make life better for everyone. And I think it's also important, although we do have quite a white panel here on virtually today, to recognize the fact that Canada, United States, other areas are really much more diverse. And so in designing those sort of inclusive environments, we have to keep it in mind, not just people's physical and cognitive abilities, but also different cultural perspectives and so on. So that's something else just to keep in mind. Sue, I think you were trying to say something as well.
I wasn't, but I will. So the question was, what does an ideal environment look like, right? And I guess two things come to top of my mind. One is funding, because the boomers are going to cost a lot of money as we go through the system. And then behind us, we have generations that, are perhaps less fortunate than we were in terms of income earning power. So funding of research, care, innovation, all of that is extremely important. And then piggybacking on what you were just saying, Allison, the other issue I'd see is, involvement of, like you said, all different types of people. We're all different. And whether that's innovation, living situations, care situations, I think we need an input, strong input into what's developed.
Yeah, so one of the things we're trying to do, as I think Sue and Sam know for sure, is building on the success that we've had with our incredibly dedicated Seniors Advisory Panel for CABHI to create a more inclusive and wide-ranging lived experience advisory panel. So our goal by 2025 is to have at least 1 million people in that lived experiences advisory panel. And thanks to Sue and Sam and all the folks on the staff for helping us kickstart that and the help that you're giving us in planning how to move that forward. It'll be a challenge, obviously, because we're going to have to find a way to connect all of those people. But I think that, in building it out that way, we will be hopefully meeting the sort of needs that Sue's just mentioned. Before I ask Sam to comment, I just want to let the whole audience know we will be taking some questions momentarily. So if people have questions, they can enter them into the chat room, and then we'll be turning to those in a few minutes. So Sam, what's your vision of a perfect future for aging?
Aging, further to what Len was saying about the shortages of workers to take care of elderly people, that's why I think artificial intelligence is going to play a big part of this, the robots. Yeah. So this way, people could stay in their homes, they have companionships, and the technology now, the robots could do cleaning, laundry, cook, everything, and you'll have companionship. So that's going to play a big part in helping people stay home, and finances as well, because your caregivers, let's say you have family caregivers, they're going to get burned out. And time management is a problem, because they have their lives too, and they're not going to get any time for say go out with friends for dinner or sporting or participate in activities, which is a huge problem. Even when we did have caregivers, my mother always wanted me to be there all the time.
Yeah.
So, yeah, but I think technology is what's going to drastically change in the next 10, 15 years, how people with dementia and Alzheimer's will continue in society.
Yeah, I think there's tremendous opportunity. Actually, Ariel Garden, who's one of the co-founders of Interaxon, who'll be joining us later today, she and I were chatting recently about how, the sort of system that she's going to be giving away at the end of the day today, she's giving away a number of different news systems that they could actually be integrated with the robots that you're talking about, to help the robots gain more information about people's inner thoughts and feelings. So, for example, in some of the later stages of dementia, sometimes people have difficulty communicating. And so, if one of the things we're trying to do in the research that goes on at Baycrest, in the Rotman Research Institute, is trying to figure out how do we basically read people's minds using these sort of devices that Ariel and her group have invented. If we can help, share that information with robots or, your house, the Internet of Things, you could imagine now, that your thermostat could know when you're feeling too hot. Your TV could know when you've fallen asleep and it could turn itself off. I mean, so there's all sorts of things that could be done to help people stay in homes longer and age better. So, thinking about those kinds of ideas that we've talked about, thinking about isolation, stigma, loneliness, thinking about caregiver needs. If you had a word or two of advice for innovators,
strongly believe in involvement of older adults along the journey of innovation. We think that, and we've seen innovators be very, I don't know the word I'm looking for, but they were very appreciative of what they've learned. They do actually learn something when they come to users, end users. So you could come, for example, at the concept stage. You could come at a stage where you're testing a product. And for example, you want a focus group or you're developing metrics, or you could come at an end stage when you're looking for some feedback on your final product or service for things like user friendliness, fine tuning of labeling and things like that. So that's the advice I think that I would give to innovators, to involve end users early and often.
early and often. That's a great idea. Sam, your advice.
I agree with Sue. End users, we need to be involved with the innovators. They should bring it as soon as possible so we could go over everything, and that's the best way to get the correct innovation for the people who need it. So I agree exactly with Sue. Said the same thing I would say.
Ron.
Well, Sue, you're going to be well supported, 100% here, I think.
Yeah.
The Alzheimer's Society for Canada put out a paper last year or two. It's a great concept. Nothing about us without us.
Right.
I can't think of, you can't go ahead with innovation for an audience unless you've got that audience involved. And the one of the things I find is that the experience of the older mind, even if that person has dementia, is invaluable. I love the ideas of a younger person. I love all the new tech concepts. But when you put that together with the lived experience of a person with dementia, it's incredible what could and can be achieved, and everybody benefits from it.
Yeah.
That's
True. Len, yeah.
that's it's kind of like my suggestion is encouragement, and it's encouragement for persons with lived experience to participate. Far too often they're too shy. They think they're not smart enough. They think their ideas are not worthy. And I, from my experience in dealing with huge numbers of people sometimes, no idea is too small. No idea is too little.
Right.
It's all good. And these innovators are going to be able to take those minute sometimes ideas and turn them into something good. So it's participation that does it. And it's the encouragement for all people of all ages, especially seniors, people who've been around a while, to kick in their thoughts, ideas, and emotions even.
So I think that's a really important point that, the folks we brought together in the Seniors Advisory Panel, I think it's fair to say you guys have felt like you've learned quite a lot from it as well. And you've discovered, although you all were, had successful careers and backgrounds coming into it to start with, you've discovered new skills. And abilities taking part, and yeah, there's no contribution that's going to be too small. And I appreciate all of your contributions here today, and I look forward to continuing that conversation. For folks who don't know about our podcast, we actually did a podcast. Sue was part of that one a couple of months ago, talking about end user engagement. So you can hear much more about our views, Sue's, mine, and others on end user engagement, the importance of it, and look for more information as we're building this lived experience advisory panel. Thank you, Sue, Sam, Ron, and Len for all of your contributions, and we'll look forward to continuing chatting. I'm going to turn it over to Mel now.
Thanks.
Thanks, Allison. Thanks,
Thank you
everyone.
all.
Thank you.
Have a great day.
Thank you. Have a great day.
The Center for Aging and Brain Health Innovation is powered by Baycrest. To listen in and get involved, go to cabhi.com. The podcast technicians behind the scenes are Podtex. Share your What's Next Canada podcast ideas with us at www.podtex.com. PODTECHS. Podtex, your partners in podcasting.